Okay, so we are entering the scene. I see a chair that could be a hazard, so I'm going to move that out of the way. I think the possible mechanism of injury is a fall down the stairs, so we're going to investigate that. I see one casualty. I have my two other responders, and we have our packs, and we can call 911 for additional resources as required. We have our gloves and goggles on as our PPE, and I don't think we need anything else as of right now. My general impression is that we might need to rapidly transport because it appears like our chief complaint might be unconscious. Hello, can you hear me? Can you hear me? Trap squeeze. Okay, so our patient is responding to pain, so our level of responsiveness is pain. Responder 2, could you come in and return the head to midline and take spinal motion restriction, because I think the mechanism of injury, we're going to need to do that. And then going to check ABCs, so I'm opening the jaw with a modified jaw thrust. I can see in the mouth, I don't see anything in there. I'm going to check breathing. I see full regular breathing, and I'm going to check pulse. And I feel a strong regular pulse. I'm going to start my rapid body survey, so I'm looking at the head. I see some bruising and bleeding here on the forehead, so I'm not going to touch that. Everything else appears stable. The neck appears stable. I feel full regular breathing, and the chest seems stable. I don't note any rigidity in the abdomen. The pelvis is stable. Upper legs are stable. And I notice a pain response in the lower leg, so I'm going to observe it. I'm noting an open fracture here, so we're not going to touch that. And then feeling the feet, they appear stable and warm. I'm looking at the arms. Arms appear stable. I note a medical alert bracelet on this hand, and feeling the back where I can see, and I don't notice any blood or instability. I'm going to move to pulse oximetry. I'm going to get out my SpO2 monitor and put that on. And I note an SpO2 of 95. For transport decision, I think we should rapidly transport. Responder 3, could you call EMS?
I'll make that phone call for you.
And I think patient positioning until EMS arrives, I think we're in a good positioning holding spinal motion restriction, so we can start our secondary assessment.